Welcome to another episode of Med Madness. In today's podcast, we will be discussing the fascinating and essential topic of apoptosis, also known as programmed cell death. We'll explore the two primary pathways of apoptosis, the intrinsic mitochondria-mediated pathway and the extrinsic receptor-initiated pathway. Understanding these mechanisms is crucial for comprehending how our bodies maintain cellular balance and eliminate damaged or unnecessary cells. By the end of this episode, you'll have a clear understanding of the role apoptosis plays in health and disease, particularly in contexts such as cancer and immune responses. Next, let's discuss the pathways of apoptosis. The intrinsic pathway, also known as mitochondria-mediated, is initiated by various forms of cellular stress, including damage from ultraviolet light, heat, hypoxia, toxins, or radiation. When cells are damaged, they display intrinsic apoptotic signals such as phosphatidylserine or thrombospondin on their plasma membranes. The control mechanism for the intrinsic pathway involves a family of proteins known as BCL2 proteins. These proteins are divided into pro-apoptotic such as BAC, BAX, and BIM, and anti-apoptotic such as BCLX and BCL2 members. Apoptotic signals tip the balance between these forces, resulting in changes to the inner mitochondrial membrane. These changes lead to the formation of the mitochondrial permeability transition and the release of cytochrome C and other pro-apoptotic proteins into the cytoplasm, activating caspases. Now let's talk about the extrinsic pathway, also known as receptor-initiated. This pathway is triggered when specific ligands such as tumor necrosis factor or FA's ligand bind to their respective receptors, TNFR1 or FAs, on the cell surface. This binding brings pro-caspase molecules into close proximity, leading to their activation. Both intrinsic and extrinsic pathways converge in the destruction phase, where caspases, the proteolytic enzymes, are activated. Caspases contain cysteine and cleave aspartic acid residues, leading to the systematic breakdown of cellular components. There are two types of caspases: initiator caspases, which activate effector caspases, and effector caspases, which execute the cleavage of cellular proteins. Let's consider a real-life case to illustrate the importance of apoptosis. A 45-year-old man diagnosed with a rapidly growing tumor undergoes chemotherapy. The treatment targets and damages the tumor cell's DNA, triggering the intrinsic apoptotic pathway. The damaged cells display phosphatidylserine on their surfaces, signaling for their removal. The balance between pro-apoptotic and anti-apoptotic BCL2 proteins shifts, leading to mitochondrial changes and the activation of caspases. As a result, the tumor cells undergo apoptosis, reducing the tumor size and contributing to the patient's recovery. In this episode, we've delved into the critical process of apoptosis, exploring both the intrinsic and extrinsic pathways and how they converge to maintain cellular balance through the activation of caspases. Understanding apoptosis is fundamental in fields such as oncology and immunology, as it plays a vital role in eliminating damaged or unnecessary cells. To enhance your learning experience, we encourage you to engage with the pre- and post-podcast quizzes and utilize the Anki flashcards provided. These tools will help reinforce your understanding and retention of today's topic. Thank you for listening to Med Madness, and stay tuned for our next episode.